Hello, welcome back. In this second of two video lectures, we're going to talk about coding congenital conditions by body system. So let's get started. Okay, believe we left off here. So let's talk about some of these chaptered conditions. And again, these are organized by body systems. The codes, like the musculoskeletal system, since we're talking about limbs, we need to address laterality and the specific forms of these conditions. We also have eponyms, in other words, a condition that's named for somebody who studied the condition. And these include Down, Patau, and Edward. Chromosomal abnormalities are classified into 9 different categories to distinguish the nomoschism, translocation types, and mosaicism. Anyway, sorry about fracturing that word. It's been a long week. So we have 3 major causes of these congenital anomalies. They could be chromosomal, in other words, either too many chromosomes or an abnormal. These could be hereditary or arising during conception. We could have environmental exposures, things like medications, alcohol, cigarettes, chemicals. And we could have some sort of maternal illness like rubella during pregnancy. And the fetus is most vulnerable during the first trimester, which explains why the timing of the exposure really matters so much. We'll look at the nervous system disorder. And again, as we talked about on one of the first slides in this chapter, the congenital defects of the nervous system involve Q0's code categories Q00 through Q07. And this involves the central nervous system, the brain, the spinal cord. It also involves associated tissues. And we have some examples. These include such things as neural tube defects, microencephaly, hydrocephalus, and spina bifida. Spina bifida results from a defective closure of the vertebral column. And again, with spina bifida codes, we want to make sure that we get anything that we should, the additional codes that cover the manifestations. And for those of you that are rusty on what exactly spina bifida is, you can review figure 20.1 in your book. And we have some congenital defects of the cardiovascular system, the Q20 through Q28. And these include the patent ductus arteriosus, the PDAs. We have ASDs, atrial septal defects. We have ventricular septal defects, commonly referred to as VSDs. And then we have the pulmonary artery anomalies. Surgical repair is common, but the congenital code remains valid as long as the condition exists or has lasting effects. With the respiratory system, these conditions are coded to code categories Q30 through Q34. This includes any congenital anomaly that covers the lungs, the trachea, the nose, and some examples include lung hypoplasia, lung dysplasia, and these conditions often require immediate medical or surgical care, especially in newborns. We have digestive systems and orofacial defects, and some orofacial defects that you're probably familiar with include cleft lip, cleft palate. These can either be unilateral or bilateral, partial or complete. We also have further downstream in the digestive system, we have pyloric stenosis. In other words, this narrowing, and the infant eats well initially, develops vomiting at 2 to 3 weeks, and this can lead to dehydration, and other problems. And this results from hypertrophy of the circular and longitudinal muscles in the pylorus and the distal antrum of the stomach. And really gets into a lot of details when you look at the operative record and the condition itself. We also have congenital genitourinary tract defects, and these affect the reproductive organs and the urinary systems, and this could include uterine aplasia. This could include bladder exstrophy, hypospadias, epispadias, and others. And again, just a quick note about renal angiogenesis. Bilateral renal angiogenesis is life-threatening and often it affects sequencing or documentation urgency. We also have musculoskeletal defects falling through Q65 through Q79. And these run the gamut. These can be very mild or very severe. Some examples include clubfoot, and this could be both varus, in other words, turning inside, valgus, turning outside, or cavus, high arched. And clubfoot is kind of a general term. And the one thing to bear in mind about coding clubfoot conditions is we want to use the most specific code we can. Because again, it goes back to that general coding guideline. We're going to code to the highest level of specificity. We also have chromosomal defects. These fall into code categories Q90 through Q99. And these are, again, as we've talked about before, either an abnormal number of chromosomes or structural chromosomal defects. And each condition produces a predictable pattern of abnormalities, and sometimes this includes cardiac defects as well. Genetic disorders not elsewhere classified. Of course, we have something that's not elsewhere classified, and these have some very specific types of notes in the tabular, and they'll say such things as code ADHD, F90 codes, code autism spectrum disorder, F84.0, code developmental and epileptic encephalopathy, epilepsy, and more. So very important as you go through these specific genetic disorders not elsewhere classified in the code category QA0, follow the tabular. So just a couple of recurring themes that come here in this chapter. If it's present at birth, you code it for the life of the patient. If it's corrected, use the history code. And then again, always read the tabular, and especially in this chapter, look for associated conditions that require additional coding. And these should be mentioned in the tabular. And that's all I have for you. Thank you for watching, and we'll see you online. Bye now.